Physical examination of the skin, hair, and nail. For this module, we will going to observe the skin as you assess body parts, assess skin moisture or dryness and temperature, identify any lesions, noting their location, distribution, arrangement, type, and color. We will going to inspect and palpate the hair and nails, as well as continue your assessment of the skin as you examine the other body regions. For the preparation, we will be needing strong direct lighting, small centimeter ruler, pen light, gloves, magnifying glass, tongue depressor, and examination gown and drape. We will going to explain the procedure to the patient, position the client appropriately, ask the client to undress and drape himself appropriately, make sure the room is warm, quiet, and adequately lighted, ensure patient privacy, and wash our hands. We will going to obtain health history. We will going to conduct complete physical examination. Note the person's normal skin coloring. Begin by examining hands and fingernails to accustom the client for touching. Pay attention for areas with skin folds. Stand back to get an overall impression and notice patterns of lesions. Assess the skin as one entity. For the procedure, we will going to begin with inspection. Inspection is the main skill used in general survey, observing the client in a close, focused manner using vision and smell senses. It begins during the first contact with client and continues throughout the assessment. It requires good lighting and sometimes equipment to enhance vision or examine hidden areas of the body. It provides information about body parts, color, size, location, movement, texture, symmetry, odor, and etc. We will going to inspect skin for color. While inspecting the skin coloration, note any odor emanating from the skin. We will going to inspect also for thickness, symmetry, bruises, scars, scratches, wounds, unusual marks, presence of skin lesions, and edema. Let's now proceed to palpation. Palpation means touching the body with different parts of the hand using varying degree of pressure. It provides information about body organs, about size, shape, moisture, temperature, pulsation, vibrations, position, consistency, and tenderness. It confirms findings of inspection. We will going to palpate the skin for first, moisture. Perspiration appears normally on the face, hands, axillae, and skin fold in response to activity, a warm environment, or anxiety. Next, temperature. Skin should be warm and the temperature should be equal bilaterally. Warm suggests normal circulatory status. Hands and feet may be slightly cooler in a cool environment. Use dorsal part of the hand to assess temperature bilaterally. For texture, normal skin feels smooth and firm with uneven surface. For turgor and mobility, we will going to do tenting test. We will going to pinch up a large fold of skin on the interior chest, over sternum or under the clavicle, or forearm and release. Inspect for ease of skin rising and time to return to place. Turgor is an excellent indicator of adequate hydration and nutrition. Next, for edema, finally palpate the feet, ankles, and sacrum. If edema is present upon palpation, it leaves a dent in the skin. Grade any edema on a 4-point scale. 1+ for mild pitting, slight indentation, no perceptible swelling of the leg. 2+ for moderate pitting. Indentation subsides rapidly. 3+ for deep pitting. Indentation remains for a short time, legs look swollen. 4+ for very deep pitting. Indentation lasts a long time, leg is very swollen. Next, if skin lesion is observed, note the type of the skin lesion. Examination of the skin lesion. We will going to use pen light or magnifying glass. Inspect the lesion for Location and distribution of the body. Generalized or localized to area of a specific irritant around jewelry, watch band, and around eyes. We will going to inspect also for the color, elevation, and depth. If it is flat, raised, or pedunculated. We're going to inspect size in centimeters. Use a ruler to measure dimension. We're going to inspect for content, solid or fluid exudates, note its color or odor. And lastly, for the border, if it is regular or irregular. Next, palpate skin lesion. Put gloves on and palpate the lesion between the thumb and index finger for size, mobility, consistency, and tenderness.
Let us now move on to the inspection and palpation of the hair and scalp. First is we need to inspect for its color, distribution, quantity, hygiene, texture, and presence of scalp lesion. For the inspection and palpation of the nails, first is we need to inspect for the nail's shape and contour. This includes the nail surface, the nail folds, edges, as well as the hygiene. We also need to inspect for the nail's consistency and color. Then, we measure the nail base angle. By doing this, we will be assessing the clubbing of the nails. This includes the profile sign and the Chambrot's window test. We may do this by having the patient place the first phalanges of the forefingers together, then inspect the space between the opposing forefinger. Then we will now test the capillary fill of the nails. First is we need to depress the nail's edge to blanch and then release, noting the return of the color. We will now palpate the nails for texture, firmness, thickness, and adherence to the nail bed.